Peripheral neuropathy is a condition caused by damage to the peripheral nerves, which are the network of nerves outside the brain and spinal cord. These nerves transmit signals between the central nervous system and the rest of the body, enabling sensations, movement, and muscle control. When they are damaged, it can lead to various symptoms, including pain, weakness, numbness, and tingling, typically in the hands and feet. Peripheral neuropathy can have many causes, including diabetes, infections, trauma, exposure to toxins, and certain medications. Causes of peripheral neuropathy. Peripheral neuropathy can result from a range of underlying health conditions or external factors, including diabetes. Diabetic neuropathy is the most common cause, especially in individuals with poorly managed blood sugar levels. It usually affects the feet and legs first. Infections. Certain viral or bacterial infections, such as shingles, HIV/AIDS, Lyme disease, and hepatitis C, can lead to nerve damage. Autoimmune diseases. Conditions like lupus, rheumatoid arthritis, and Guillain-Barré syndrome can cause the immune system to attack the nerves. Trauma or injury. Injuries from accidents, falls, or repetitive stress, e.g., carpal tunnel syndrome, can damage peripheral nerves. Toxins. Exposure to heavy metals like lead and mercury, industrial chemicals, and certain medications, chemotherapy, drugs, for example, can damage nerves. Nutritional deficiencies. Deficiencies in vitamins, especially B vitamins B1, B6, B12, vitamin D, and niacin, can impair nerve health. Chronic kidney disease. When the kidneys fail to remove toxins from the blood effectively, it can lead to nerve damage. Alcoholism. Chronic alcohol use can cause nerve damage directly and through vitamin deficiencies. Inherited disorders. Conditions like Charcot-Marie-Tooth disease are genetic disorders that cause nerve damage. Medications. Certain drugs, particularly chemotherapy drugs, can cause neuropathy as a side effect. Types of peripheral neuropathy. Peripheral neuropathy can be classified based on the types of nerves affected. Sensory neuropathy affects the nerves that transmit sensory information, leading to numbness, tingling, pain, or burning sensations, typically in the extremities. Motor neuropathy affects nerves that control muscle movement, leading to muscle weakness, cramps, twitching, and loss of muscle control. Autonomic neuropathy affects nerves that control involuntary functions, such as blood pressure, heart rate, digestion, and bladder control, causing symptoms like dizziness, digestive issues, or abnormal heart rates. Mixed neuropathy involves a combination of sensory, motor, and autonomic nerve damage, causing a mix of symptoms. The symptoms of peripheral neuropathy vary depending on the type and extent of nerve damage, but often include numbness and tingling, usually in the hands and feet. This can spread up to the legs and arms. Burning or sharp pain. Some describe it as electric pain, which can be constant or intermittent. Muscle weakness, difficulty lifting objects, stumbling, or decreased coordination. Increased sensitivity to touch. Even light touches may be painful. Loss of coordination and balance, a common symptom in advanced neuropathy. Autonomic symptoms. If autonomic nerves are affected, symptoms may include dizziness from blood pressure drops, digestive issues, excessive sweating, or difficulty controlling bladder and bowel functions. Diagnosis of peripheral neuropathy involves a combination of physical exams, patient history, and diagnostic tests to determine the cause and severity. Physical examination and medical history. The healthcare provider will review symptoms, medical history, and risk factors like diabetes, alcohol use, or recent infections. Neurological exam. This includes testing for reflexes, muscle strength, sensation, and coordination to assess nerve damage. Blood tests. Blood work can identify underlying conditions, such as diabetes, vitamin deficiencies, or infections. that may cause neuropathy. Electromyography (EMG) and nerve conduction studies. EMG measures the electrical activity in muscles, while nerve conduction studies assess the speed and strength of signals in the nerves, helping to pinpoint areas of nerve damage. Imaging studies. MRI or CT scans can be used to check for structural problems, such as herniated discs or tumors that may be compressing nerves. Nerve biopsy. In rare cases, a small piece of nerve tissue is removed and examined to look for abnormalities. Skin biopsy. This test involves removing a small skin sample to examine the nerve endings, particularly useful in diagnosing small fiber neuropathy. Treatment focuses on managing the underlying cause, alleviating symptoms, and improving quality of life. Options include managing underlying conditions. Diabetes management. Controlling blood sugar levels can help prevent further nerve damage. Vitamin supplementation. Addressing deficiencies, like B12, can alleviate symptoms if neuropathy is related to poor nutrition. Medications for symptom relief. Pain relievers. Over-the-counter options like acetaminophen or NSAIDs may help, but stronger pain medications may be needed for severe pain. Antidepressants. Tricyclic antidepressants e.g., amitriptyline and SNRIs e.g., fluoxetine can relieve nerve pain. Anticonvulsants. Medications like gabapentin or pregabalin can help reduce nerve pain and sensations of tingling or burning. Topical treatments. Lidocaine patches or capsaicin cream can be applied to painful areas for localized relief. Physical therapy. Exercises guided by a physical therapist can improve muscle strength, mobility, and balance, reducing the risk of falls. Transcutaneous electrical nerve stimulation TENS involves using low-voltage electrical currents to reduce pain and improve nerve function. Occupational therapy. An occupational therapist can provide assisted devices or techniques to help with daily activities. Lifestyle modifications. Exercise. Regular, low-impact exercises, like walking or swimming, can improve circulation and reduce neuropathy symptoms. Dietary changes. A well-balanced diet rich in vitamins and antioxidants can support nerve health. Limiting alcohol. Reducing or eliminating alcohol can prevent further nerve damage in cases related to alcohol abuse. Surgical intervention. Surgery may be needed if the neuropathy is caused by nerve compression, such as in carpal tunnel syndrome. Alternative therapies. Techniques like acupuncture, meditation, and yoga may provide additional symptom relief and reduce stress, which can aggravate pain. Complications. Peripheral neuropathy can lead to several complications, especially if it's not managed effectively. Increased risk of injury. Loss of sensation makes it easier to get burns, cuts, or injuries without noticing, particularly in the feet. Infections. Minor injuries may go unnoticed and become infected, especially in people with diabetic neuropathy. Falls. Balance and coordination issues can lead to an increased risk of falls and fractures. Chronic pain. Neuropathic pain can become debilitating, impacting quality of life. Reduced mobility. Weakness or pain may limit the ability to perform everyday tasks. Prevention. Although not all cases are preventable, some measures can reduce the risk of developing peripheral neuropathy. Manage chronic conditions. Proper management of diabetes, kidney disease, and other chronic illnesses is crucial to prevent neuropathy. Healthy lifestyle. Regular exercise, a balanced diet, and avoiding alcohol or tobacco can protect nerve health. Avoid toxins. Limiting exposure to toxic substances, including certain chemicals and heavy metals, can reduce the risk of neuropathy. Foot care. Regularly inspect feet for injuries, wear supportive shoes, and practice good hygiene to avoid complications. Routine medical check UPS. Regular check UPS can help detect early signs of neuropathy or its underlying causes. Outlook. With early diagnosis and proper management, The symptoms of peripheral neuropathy can often be controlled, and progression slowed. However, the outlook depends on the cause and severity of the condition. For some people, treatment can alleviate pain and improve quality of life, while for others, symptoms may persist or worsen, especially if the underlying cause remains unaddressed.